Thank you so much, Terry. It's great to be with you. I loved your TED Talk on don't choose your passion, let your passion choose you. And in a sense, my passion chose me. I never intended to be a spokesperson or a face of someone in recovery, championing addiction and mental illness. I was taught very early in life to keep those things secret. And as they say in recovery, you're only as sick as your secrets. And I have suffered a lot of sickness in my life because whenever I've tried to keep these things secret, they pathologize and become worse. And really, I think the point of today's meeting and that of yesterday and what Mequilibrium's trying to do is, open the light of day onto people's neuroliteracy and understanding that mental health is a spectrum from mental wellness to mental illness. And we all fall at various times in our lives somewhere on that spectrum. And with Mequilibrium trying to go upstream, we have a better shot at trying to stay in the wellness category by looking for those signals for where we're in trouble. And I love the fact that Mequilibrium can guide people to treatment if they need it. I just wanted to start by saying, as I mentioned at the beginning, I never intended to be the spokesperson or even the sponsor of the Mental Health Parity and Addiction Equity Act. What happened to me was I was in treatment for drug addiction, alcohol addiction, cocaine addiction when I was 17 years old. And of course, I wanted to keep that a secret as I entered politics and public life. But I was a Kennedy, and my second term in office, it turned out that the guy that I was in drug rehab with decided to sell his story about being in drug rehab with a Kennedy to the National Enquirer. And I woke up one morning as a second term office holder in Rhode Island to find my face on the cover of every National Enquirer in my district. And I thought my political career was over. But I was fortunate to find out that in my Italian-American community, with Rhode Island being the most Italian-American state per capita in the country, the only thing that my constituents hated more than a drug addict was someone who ratted on a drug addict. So I ended up getting reelected because they didn't want to look like they were siding with the folks that had ratted me out. And I went on to Congress as an elected official who had his past kind of well known. And that put me in a unique opportunity to sign on to a bill that had the words mental in it and had the word addiction in it. And of course, most of my colleagues in Congress who may have been interested in supporting this bill were very reticent to put their name first, to be the primary sponsor. And that's understandable. A stigma was alive and well, still is, but thankfully less so than it was 20 years ago when I first signed on to this bill. They knew that if they'd sponsored the bill that, within minutes, the press would be asking whether they or their family members had ever suffered from a mental illness or addiction. And then if they did, how was treatment doing? And then what medications were they on? And so forth and so on. And of course, no politician wants to go down that rabbit hole. So I got to be sponsor by default, principally because no one else wanted to be sponsor. And says a lot about where we've come in terms of stigma. I was the youngest member of Congress at 27 from the smallest state in the country in Rhode Island. And in the minority party, I basically was the lowest guy on the totem pole. And yet I got to put my name first on such a major bill of consequence simply because that's how powerful stigma and shame was, and unfortunately still is to some extent. What my bill basically does, as you said, Terry, is basically say to payers, you can't discriminate against these illnesses. Inpatient, in-network, outpatient, in-network, inpatient, out-network, outpatient, out-network, pharmacy benefits and emergency room benefits. You need to cover the full spectrum of treatment, primary, secondary, and tertiary care. And as all of our audience knows who are actively involved in HR in their companies, they know that their third-party administrators really don't do the job for them. And the reason is because there's no true fiduciary for those insurance companies to look out for your mental health. And the reason is that the churn within insured populations changes year in and year out. And none of those insurance companies really see their ROI for investing in good mental health and prevention, see that return on investment. And what they don't calculate into their bottom line is that by not making mental health a priority in their coverage, their clients, meaning everyone on this call who's a business in business, they pay the price, not just in higher physical costs, but in higher cost to disability, higher cost to workers' comp, lower productivity, higher absences and more presenteeism. All of those things have an enormous cost on business. And yet that's not in the interest, that's not on the bottom line of insurers. So I really want to underscore why Mequilibrium plays such an important role in this spectrum of services that all of your audience who are kind of in the HR business have to look out for, because payers don't always have that same interest at heart. Good news is that we're moving towards more value-based purchasing, and I really see that as the jailbreak for more mental health and addiction treatment, because now payers will realize what the Millman report and so many others have demonstrated, and that is investment in mental health and addiction is a force multiplier. It really reduces total cost of care. And if you're underwriting the total cost of care, then mental health will not be something that we have to come in with a hammer from the federal government and Department of Labor overseeing ERISA laws to hammer payers that you're not doing enough to provide equal coverage. Hopefully, they'll see the benefit of providing more coverage and see it as a financial win for everybody involved, which it is. So I had the honor throughout my time in Congress to fight for integration of mental health. And I fought for it within our education system because, as we all know, most of these illnesses, 74%, occur in people under the age of 24. And 75% of the onset of these illnesses are before age 24. And we really know that schools are the place where we can identify people who are struggling earliest. And the key, as Mequilibrium kind of has adopted as its philosophy, is that early intervention, that ounce of prevention is worth a pound of cure. Early intervention is where we ultimately need to go in mental health to prevent the mental health and addiction crisis, which is plaguing us today, principally because we wait so long to treat these illnesses. As my friend Paul Gianfrido from Mental Health America says, we have to capture these illnesses before stage 4. But as all of us know in our own lives, we only wait until they become crises before we intervene. And we need to obviously change that. And I love the fact that Mequilibrium's kind of an early warning system of sorts that can signal, populations of health that in different offices that may be higher risk for anxiety, depression, and individuals who may need more services through their EAPs or through their third-party administrator. We're really lacking in that early warning system. And so I've advocated for mental health in our criminal justice system. As we know, there's 75% recidivism within 5 years of people leaving jail. Why would we pay for a criminal justice system where 50% of violent crimes are committed by those who previously been incarcerated, but never rehabilitated? Thankfully, we're also at a historic point where we want to finally correct our correction system. It's long overdue. And so, really from a public policy point of view, mental health is in everywhere in life. It's in our education system, it's in our criminal justice system, it's certainly in our healthcare system. And it's in our workplace, which is why you're all on this call and why hopefully you've subscribed to Equilibrium as one of the tools in your toolbox. As a person in long-term recovery, which for me means that I haven't had to use drugs and alcohol since February 22nd, 2011, I really focus on acting my way to a new way of thinking, as opposed to thinking my way into a new way of acting. It's called cognitive behavioral therapy. And unfortunately, we do not really translate the evidence form of treatments to the public in the way that we should. And that's one of the reasons why we wait and why our nation's mental health is in such critical care now, because our healthcare system really doesn't screen for these illnesses. If you have a family history of cancer or diabetes or cardiovascular disease, the physician in their doctor's notes and in their physician prompts will have a bunch of questions about whether you have that family history. Not the case in mental health. It's even so bad that people like myself in recovery from opioid addiction, in addition to all other addictions, when I go to the hospital for an injury, I'll put down that I'm allergic to not only penicillin, I'm allergic to opioids. And even after I've made that known in my healthcare system, I constantly still get offered prescriptions for opioids. It's just something that's missing in the DNA of our medical system to really take addiction and mental illness as seriously as we need to take it. And I'm really hopeful in the future we'll give people kind of that toolkit for life. You know, those of us in recovery are so blessed because we have 12-step recovery. It gives us, as they said, the guidebook to living. And I really think that's the kind of guidebook we need to give all Americans, because we can all benefit from really thinking through what are our counterproductive thinking patterns. Like, how is it that I get stuck in a rut in my life doing the same self-defeating behavior over and over again? Maybe it's because when I'm a very reactive person, that the trauma in my life has forced me to be very reactive, and I don't always recognize when I'm being reactive. But with mental fitness, you work out, much like you would physical fitness, those exercises in your mind to better help you manage the intrusive thoughts and the counterproductive thoughts that get you into trouble. And it's going upstream. So, it was interesting for me being in Congress at an important time for the history of the Green Berets, which my uncle, President Kennedy, first founded. And I was asked to go down to Fort Bragg to speak to the Green Berets and the John F. Kennedy Special Warfare Center. And when I was down there, never forget, Hugh Shelton, first Green Beret ever to become chairman of the Joint Chiefs of Staff, told me, Congressman Kennedy, the Green Berets have more access to mental health than any other branch of the services. Because of course he read my CV and saw that I was a big champion for mental health. And I said, General, I'm still going to support this place. It's got my family name on it. I love the Special Forces. Who wouldn't? These folks jump out of planes and hit the water, and they swim underwater for 5 miles without breathing. They'll come out on the beach and they'll speak 5 languages. They'll take out their target, and by dinner time, they'll be reading to their kids. They're the last people who need mental health. And he said to me, Congressman, you don't understand. And I said, what's that, General? And he said, in the military, in the special forces, we see mental health as a force multiplier. In other words, we have invested millions of dollars in our soldiers. They're going to be called to duty at a moment's notice. When they get into the field, they cannot have anything else in their mind but the mission. They cannot be distracted by intrusive thoughts. And if they are, not only do we compromise the mission, we compromise the safety of their teammates. And it always stuck with me because I was used to looking at mental health as the glass of half empty. And he was talking about mental health as the glass of half full, and that the real job of mental health is to fill us up with the kind of resilience and the self-actualizing kind of thinking and behavior that allows us, in the words of the Army, to be all we can be. And I've always thought that the real answer to our nation's public health crisis of mental illness and addiction is to really go upstream, really start to train our young people at the earliest of ages, how to self-modulate their own emotions, how to identify them, how to develop coping skills and problem solving skills. If you think about it, how can they learn numeracy or literacy if their amygdalas are on fire, if their prefrontal cortex cannot absorb information from the teacher because of the trauma that they've suffered? This is not soft science anymore. We have longitudinal studies like the Adverse Childhood Experience study from Kaiser. We have numerous other studies that tell us about the neurobiology of mental illnesses and addiction. And the exciting thing about all of this is that we're really in the midst of the last medical frontier. Just before I left Congress, I was at a John F. Kennedy board meeting for the John F. Kennedy Performing Arts, and the director said, next year we're going to celebrate the 50th anniversary of President Kennedy and the new frontier. Of course, President Kennedy's time in office was known as the new frontier. And I went on to my office and I was meeting with Husseini Manji, who is a big researcher at the National Institutes of Mental Health, because I was on the NIH Appropriations Committee. And he said, Congressman, the brain is the last medical frontier. And of course, like a good politician, I saw JFK, New Frontier, neuroscience is the last medical frontier. I asked my cousin Caroline, could I kick off this foundation as I'm leaving Congress dedicated to neuroscience? And she said, listen, Patrick, we're already set for honoring Daddy's 50th anniversary, but you can have May 29th at the library. I didn't know what that meant, so of course I Googled JFK, May 29th, and I saw that was the time when President Kennedy gave his moonshot speech, when he said that we were going to put a man on the moon and return him safely before the decade is out. That's how he said it. And what's so remarkable is he set into motion the biggest expansion of our research into computing, because we needed supercomputers to accomplish that mission, to go to outer space. Today, to go to inner space, the race to the galaxy of neurons in our brain, it's going to require supercomputing, because the only computer that we've never been able to crack, the only hardware and software we haven't figured out how to manage, is the one in our brains. But we have the artificial intelligence, we have the computing capability today, if we reach a kind of international agreement, to really understand the brain like we've never done before. And we started One Mind for research on the 50th anniversary of JFK. I know many of you work with One Mind at work. And then we went on to create the Kennedy Forum on the 50th anniversary of John F. Kennedy's signing the Community Mental Health Act. And when he signed the Community Mental Health Act, he finally was able to acknowledge that his sister, my Aunt Rosemary, not only had suffered from an intellectual disability, but also a psychiatric one. And that was a watershed moment in public policy. 50 years after JFK signed the Community Mental Health Act, I was with President Bush in the Oval Office with my late father as he signed the Mental Health Parity and Addiction Equity Act on the same desk as my uncle signed the original Community Mental Health Act. To your point, Terry, your passion chooses you. I never would have made that my life's plan. And I never would have been able to forecast and see in the future that all of my own experiences as someone in recovery would have bolstered my advocacy for this mental health bill. That the guy that ratted on me is someone I to every night in gratitude that he did that, because he changed the course of my life and how I responded to these illnesses. And in the course of all that, my mental health gets better as I get more connected to my fellows in recovery, because I happen to be public through no choice of my own. And I just want to thank everybody in the HR world, because you are doing such an important job at helping us improve society in this space. And, President Kennedy, before he signed the Community Mental Health Act, he was the first president to address civil rights as a moral issue. And he said, who amongst us would trade the color of their skin and be content with those who counsel patience and delay? And of course, back in 1963, everyone was saying about civil rights, let's go slow. Let's not rush civil rights. And I'm so proud that Kennedy stood up for it. But I'm saying that because today, people might think we're rushing by doing too much on mental health. But if you have a family member, if you have a loved one, if you have a work colleague suffering from these illnesses, you know that we cannot move fast enough to help them out and set them free from being prisoners in their own minds. And equilibrium is part of the process to kick down the doors like our Green Berets, open up the light of day and allow people the freedom to walk out from their prisons and into a more productive life at work and at home with their family, and of course, in our community as a nation. I thank everybody for what you're doing out there, and certainly look forward to, as we say in recovery, trudging the road of happy destiny as we fight the good fight to get more people the necessary mental health that all of us need at some point in our lives. And the companies that are there to provide that are going to not only be better off, but our country will be better off in the process. Thank you so much.